uploads to his channel. Welcome to his channel again. So today we have already talked about the HCG, and we decided to let you guys know how to administer an IM or subcutaneous injection clean or sterile, having a sterile injection. So Dr. Downey, so could you tell us how to sterilize our 100% real good looking like HCG vial? What is the first step of that?
It's real HCG.
Yes.
So essentially, you're going to need a needle for injections like, a syringe and needle for injections like HCG, where we tend to use something like an insulin syringe because it's shorter, its gauge is a bit higher, so you won't get as much pain. And then you can use the same needle that you use to draw the HCG with to inject yourself. It should be fine. But the first things first, to keep it all sterile, you have to sterilize the top of the point at which you're going to draw the HCG. You want to sterilize that by what you tend to do is you start in the center and you go out like that. Or if that's
so I have a cotton swab here, like it's not an alcohol swab. Yeah, putting 80% alcohol, putting that it's like literally soaked. It's now literally soaked in 80% alcohol, and I'm starting to clear from inside to outside, like in circular motion.
Yeah, that's how we tend to do it, and that's how you do it
and
on
it's
your
literally
skin.
it's like soaked in alcohol, so I gotta pour the excess now. So my advice would be the way: don't take your time, and don't be in a hurry, or it'll hurt like a bee. It hurt like a whore, literally. It hurts. It stings a lot. 80% alcohol is quite painful to inject, so don't.
Yeah, essentially you would like it to dry, especially when you're doing it on the skin, or else you introduce that painful alcohol and it's going to sting. So wait for it to dry both times.
So since while we are waiting, you can tell us how to like clearly open and get our needle ready. For those who want to see that, we have a needle that has a needle tip that can be changed. So it's not the one of those that already come with needle on top of those. It's a 1cc syringe that has 26G needles. So you can go ahead, Dr. Nick.
Well, yeah. So essentially you would like to open the packet from the base. You don't want to touch the tip of your syringe, just because you don't want to, infect it with any bacteria on your fingers. And then you're going to attach the needle to the syringe in the most sterile manner as you can.
So yes, you can, I guess, clearly see.
Yeah, you could hold it because everything inside is sterile.
I just put it there and turn it while pressing down clockwise. It's not a lure lock syringe, but turning it clockwise while pushing it helps it. So we got our needle ready, and we're gonna remove our needle cap. From now on, Dr. Nick, we should avoid touching or even blowing or spitting towards the needle tip. And a pro tip: you don't need to swipe the tip with alcohol swab, right? Some people do that.
Do some people do that?
Yeah, but some people do that. But probably they want to hurt themselves.
Yeah, don't touch the tip.
And don't wipe it with alcohol. If you touched it, just change the needle tip.
Exactly.
Yeah. Normally, yes, do we have to push air to vial if the HCG we use is in vial?
It tends to make it draw easier, but with something like HCG that's water-based, it's not really a problem. Whereas if it's like
very thin solution, right? It's a
Yeah, if it's a thin solution, you don't really need that air because by adding in the air to the vial, you're just kind of creating more pressure in the vial and less pressure in the
yes.
syringe. But
So
so
I'm
something
gonna
like HCG is not a thing. Yeah.
so I'm gonna introduce the needle, and I didn't push air because I pushed excessive amounts of air the last time I injected, so I don't need it. So I'm gonna this vial has 2 milliliters of water in total for 5,000 IUs of HCG. So in order to inject 200 IUs every other day, on average it makes, for 2 weeks it makes 700 IUs. I gotta use less than 0.1 ml, 0.8 ml. I gotta use 0.08 ml. So I'm gonna draw my needle halfway down, and I'm gonna push up to get rid of air to get 0.1, 0.9. And yes, it has 0.08 mLs. I'm gonna upside down and took out the needle. So do we need to pre-cap the needle tip? Some people do that, some people don't.
It's not necessary if you keep the needle away from anything infectious, but if you struggle doing that, you can recap it by slowly going
But
on the
it comes
side,
with the like contamination risk, right?
yeah,
Touching the needle.
So don't do it if you don't have to. Rather get everything prepared, and so you can go from the vial to wherever you're injecting it.
So what are your takes on injection techniques such as like having like airlock
It's
on
really
top?
having air is not an issue. It takes a lot of air to cause, air emboli or anything. So it's really not a problem.
So I have another alcohol swab. Again, I'm gonna wet it with, again, 80% alcohol. Technically, this alcohol is diluted by another good smelling cologne, which has like 70. On average, it has like 78 or so alcohol, technically. Everything is, what is the disinfectant percentage of alcohol? Was it over like 60? For ethanol, I mean.
Yes. I think the gold standard 70%.
Yes, so I'm gonna show my Tyson Fury body for the viewers. So that's how the optimal performance looks like.
No.
You know the guy who guy like
Yes.
slept with hookers and did cocaine for a year and won the golden belt with a dead butt. So I just clean the area in circular motions. So do I need to inject that drug with a 45-degree angle or 90-degree angle?
If you're trying to go subcutaneously, you'd like to go 90-degree or 45-degree. It's not a problem.
It also depends of the length of the needle, right?
Exactly. So yeah,
for guys who just want to know the zero waste technique, I'm gonna give them a pro tip. Just move your,
put a bit of air in.
Yeah, put off a bit of air, and I'm gonna just clean that area again in a second. Just put that. Yes, I just put 0.1 ml of air, and it's gonna be that piston will push the air, yeah, and there will be no waste. There will be no, yes, there will be nothing, as you can see. It has a bit of air, and this solution is, can you see it clearly?
Yeah.
Yeah. So I'm gonna re-clean the area again with new alcohol swab. Well, I probably need to re-edit that video too. It seems a little ridiculous. Yes, I cleaned the area with alcohol swab again and waited like roughly 30 seconds. Is 30 seconds is a great time to wait?
Yeah, it's up to you. It's up to you, like what pain you want to endure.
And since that needle is longer than 8 millimeter, I like having an angle of like 45 to maybe like 80,
okay.
like on 60 on average. So that's the 90, and that's the 45. I like having 60-ish. So I inject it slowly, and yes, I administered all of the drug, and the air cleaned out the syringe and the needle. So I'm gonna pull the plunger back, so you can see that there is no even a drop of water coming back. So
No waste.
it's yes, exactly. And again, I'm gonna put 80% alcohol, and for the better, the best method is always using a swab, right? Not squirting the fluid.
Yeah, I mean, yeah, best is to use a swab to get, the abrasive contact.
So for the safety purposes, recap the needle and discard it in a. Where do we discard the needle, Dr. Nick?
If you have a sharps box with
Exactly.
you.
And that's pretty much it. So disclaimer, I should have told it in the beginning of this video. That's 100% legitimately prescribed pharmaceutical HCG. It's not a research chemical or anything like that. So again, take it with a grain of salt. That will be pretty much. And on end of the video, I guess. Do you have anything to add, Dr. Nick?
Nothing, just a very good technique.
Also, there's another pro tip. If you are using an airlock technique, the optimal way you should administer is probably having this syringe 90 degrees towards the floor. So it can be horizontal, so it will push evenly, so you won't have any like remaining fluid, no matter how big your needle is. In bigger needles, such as like 3 to 5 milliliter needles, you cannot get away with using needle parallel to floor while using airlock techniques.
Yeah.